Good evening, dear Foxians and all viewers watching Foxy Gyan Pravah, the flow of knowledge. This is the podcast series, the Foxy Presidential Initiative, by our dynamic and visionary President Foxy, Dr. Sunita Tandulwadkar Madam. Myself, Dr. Jyoti Banglowala, Chairperson of Ethics and Medical Legal Committee of Foxy, your host for today's episode 8 of this podcast series, welcomes you all. In today's Gyan Pravah, we have remarkable personality, none other than Dr. Jaideep Tank, past president of Foxy, as guest speaker. And today's topic is violence against doctors, what we need to do. This is the most important and burning topic of today's India. Now for welcome address, I would like to invite our dear President Foxy, Dr. Sunita Tandulwadkar Madam, who is force behind this meticulously planned series of podcasts on various topics by stalwarts in their own field on various subjects. Madam is inspiring leader, motivating and empowering others to achieve their best. The dynamic and visionary President Foxy, who is leading more than 46,000 gynecs of country and abroad. She is innovative, inspirational, resilient, and above all, very inclusive leader. She is chief of IVF Endoscopy Center, Ruby Hall Clinic, Pune, founder and medical director of Solo Clinic IVF Pune, which is a state-of-art clinic. She is co-founder and medical director of Stem Cell Research and Application Center Pune. She is having credit of India's first stem cell baby and world first at age of 45. She has received many awards. Few I will mention, like she received Rashtriya Gaurav Award. She received Glory of India Award, Bharat Gaurav Puraskar, Ahilyabai Holkar Puraskar, a letter of appreciation from President of India himself in 2012. She is past president of IAG, and her academic excellence and dedication for research comes in the form of publications. She authored 18 books and 85 publications, and many numbers of fellows she mentored. She is a spiritual personality, and she always believes that spirituality is nothing but spreading love, and love. Huge effort she has taken to give us this platform to explore our talents. Your dedication inspires us, madam. All are striving for your dedication to see in this particular podcast series. Thank you all for what you are doing for all of us. Over to you, madam, for your welcome address.
Thank you, Jyoti. Thank you for your kind word of introduction. See, friends, Foxians and those who are watching this daily 8 p.m. Gyan Pravah series by my dear chairpersons. You all know 30 days, 30 chairpersons, everyone has given a date. So on 5th of every month, you will be eagerly waiting for Jyoti. The concept behind this podcast was not only to stop the webinars, which I think every 1 in 5 years have gone through, experienced, but to bring out something novel. These committee chairpersons of today are the leaders of Foxy tomorrow. It's very important for me to put in some leadership qualities to them. Their creativity, their passion, their enthusiasm has to come out. And that's where this Gyan Pravah podcast series has taken a birth. Now, they are calling maybe the academician, the expert in the field from India or outside India, the spiritual guru, politician, the social figure, anyone they wish to get. There is no control or what they can think of and whom they can get. I think Jyoti may get once the Trump also on the podcast. I won't be surprised. I am reading the names of so many people in the group, and that shows how much enthusiasm my all team members are putting in, and I'm thank you for them. It may be a vision of a Foxy president, but it will not become a complete reality unless these committee chairperson put their heart, soul, time, energy into that. Today, Jyoti has chosen Dr. Jaideep Tank. I'm so glad because he is the right person from Foxy who can talk about violence against doctor as not only the Fogsi president, but he has served the Fogsi as a Secretary General, Associate Secretary General, and he probably has helped many more who has suffered. Also, this podcast is very close to my heart because you all know my theme. The tagline is Har Ghar Foxian, because I believe that when we become a president of a Foxy, on one arm, we are working for the woman or the maternal health, but our other arm is our Foxians. And that's where we need to protect them, we need to nurture them apart from just giving the academic knowledge. And when Jyoti's topic I saw was violence against doctor, I thought this is very apt topic, and I'm sure you will all have many more questions. You can keep on posting them. If Jyoti gets a time, she can probably will take the answer and make a sequel of this podcast. Thank you so much, Jaideep, for being here with us today. I think it's always, great to come back to Foxy as a past president of a Foxy. I know how much happiness and at the same time, the satisfaction you must be having sitting over there and enjoying the way Foxy is moving. I think you have done a brilliant job. Very difficult to match up for any Foxy president, not only me. But I think a lot to learn from every president and move ahead. Thank you, Jaideep. Thank you for presiding this organization in 2024. Over to you, Jyoti.
Thank you, madam. Deeply grateful for your words. Now, over to our guest speaker, Dr. Jaideep Tank, past president of Foxy. He is the phenomenal personality, and for him, goals are dream with deadlines. We all know Sir is having deadline for everything, and we sincerely appreciate his vision and dedication towards the organization, towards women health mission, and most importantly, he is always voicing for fellow doctors at different platforms. Sir, we are so grateful that you came to this podcast series. Dr. Jaideep Tak, he was the president Foxy for year 2024. He's chair of YGAA committee, FOG. He was Secretary General of Foxy in year 2018 to 21 and awarded the FRCOG honorary causa by Royal College of Obstetrician and Gynecologist. There are so many roles Sir has played in past and so many roles are coming to him. But I would really like to mention that he is instrumental in drafting the proposal for FIGO, which resulted in a grant of $13 billion for a 10 countries project, which is 8 in Africa and 2 in South America, and was the technical lead for the project. We are seeing Sir leading the Adhuna project with Foxy and Gates Foundation and Satwa, and actually there are many more to come. Sir will tell, actually this is Sir's chance to tell about the projects. And I have chosen Sir. I am seeing a lot thing. He contributed to the electronic membership management system, e-voting for Foxy, developing a completely redrafted user-friendly constitution of Foxy, contributed and led the development of the Foxy statements in cesarean rates, hysterectomy rates, contraceptive implants, ART bill, surrogacy bill, and the Foxy's writ petition and intervention in Supreme Court on PCPNDT, IRIA, the oxytocin case and others. He reconstructed the Foxy cells, the minutes of the Foxy MCM and GBM, and even every committee chairperson of medical legal or MTP, they are calling Sir for every time. He is the most actually eminent and prominent medical legal person for us all. We are look upon to him always. Sir, over to you for a few words about this podcast series and the topic.
Thank you very much, Jyoti, for that very kind, very warm, and very generous introduction. As always, I must say. And thank you, Sunita, for initiating this wonderful series. I think this was something which was lacking in Foxy. We did not have a podcast series of any kind till now. And I think this fulfills a very, very important gap. It speaks to your vision and it speaks to the fact that you know how the gaps can be identified and filled. So thank you very much for this initiative and your leadership in general. And of course, the continuity in leadership that has been demonstrated through the period of your presidency. So thank you very much, sir. And of course, Jyoti has done yeoman's work as chair of the Medical Legal Committee. Amongst the many works which Jyoti has done, I must specifically point out her work when she made the visit as a member of the PCPNDT cell to some really remote places, and then had the gumption and the courage to stand up to things which were not going well and stood up for our members. So thank you very much for not only that, Jyoti, but for all the work that you've done. I'm looking forward to the discussions in this podcast, because I think the topic, Jyoti, that you have chosen is very, very emotional. It affects each and every doctor. And I would have to say that I don't think there's a single doctor who at some point has either not thought of this or has not apprehended this. So thank you again very much, Sunita and Jyoti, for inviting.
Thank you, sir.
Thank you, Jaideep. Jaideep, as our protocol goes, now I just join the delegate link and you and Jyoti will be having the dialogue with each other. Thank you for being with us. Thank you. Bye.
Thank you, ma'am. Thank you very
Bye,
much.
Jyoti.
Thank you, ma'am. So, sir, before we start this most awaited session, a few facts I would like to tell, because our audience is not all the medical fraternity, and there are so many non-medical audiences also joining. So, according to the estimate by the IMA, Indian Medical Association, more than 75% of doctors have seen violence at their workplace. And in last few decades, the doctor-patient relationship is not at its best. You all know this. And the trust between them has been broken to the extent of violence. And as you say, that once in a life of every doctor, he or she faces the violence. May it be verbal abuse or aggression, aggravation gestures, physical violence, mental harassment. We are seeing the cyber bullying also, blackmailing also. But the menace has not been highlighted adequately. We are seeing that it is under highlighted. So apart from every common question, I just want to know from you, as you know, we all know it happens. What do you think about the prevalence of violence against doctors or hospital violence with respect to the particular specialty, or with respect to the age, or with the respect of the gender? Because many times we are seeing only junior doctors are getting assaulted more. So is there any such things?
Thank you, Jyoti. So let me address this question in the 4 or 5 parts that you have asked it in. First, we'll address about whether this is indeed a problem or not.
Okay.
Then we'll talk a little bit about whether there are any variations in how doctors are affected. And you said that there could be variations in gender, there could be variations in age. And I would add one more variation, which is variation in violence in various resource settings. Because I think all of these are important to understand the genesis of violence, and the reasons for genesis of violence are different across different categories. So is violence against doctors a problem? Well, of course it is. I don't think you can deny it. If you say there's no violence against doctors just because medicine is a noble profession, you've probably been living under a rock somewhere. It is also equally true that violence against doctors is not an Indian problem. It's a global problem. So if you do a Medline search, for example, simple Medline search of, let's say, violence against doctors, you'll find that the place where violence against doctors seems to be most endemic, in fact, is China. And there are articles reporting violence against doctors across countries, from the least developed, from the developing countries, as well as the developed countries. I think what difference there is that the more developed countries, the laws are stringent and prompt action is taken against the offenders. This, I think, distinguishes one country from another when it comes to violence against doctors. And we will talk a little bit later about why we aren't, for example, seeing a central law on violence against doctors. But when you come to India itself, as you rightly said, it seems to be an endemic problem. And more than that, what really worries me is the fact that it seems to have got normalized. We don't get shocked by violence against doctors anymore. For me, that is actually the most concerning thing. We read about it on WhatsApp, we feel bad for the doctor, and then we shrug it off and return to work. Of course, there is a limit to what every individual can do. There is a limit to what can be achieved by your and me worrying about it. But at the same time, the sad truth is that in a way, violence against doctors has now got normalized and is no longer the sensational news that it used to be once upon. For me, that's the saddest part. It's the saddest part because it means we have somehow internalized the fact that all of us will face violence or abuse at some point. And this is not acceptable. When I was the Secretary General of Fogsi and Nandita was the president, if I remember right, we had come out with a statement saying that the old tropes of why violence occurs, and we will again go into the narrative of violence a little later, is simply not acceptable. You have to have a zero tolerance approach. Violence against doctors in any form is simply not acceptable. It doesn't matter whether there was a good reason, whether there was a bad reason, or whether there was a reason at all. It is not acceptable.
Actually, beating is not only the violence, sometimes the verbal and emotional abuse we every time faces during the billing, during the treatment part. There is so much of the emotional violence with the doctor also. So,
Yes.
what do you think? What are the main reasons for this? Because there are so much high expectation from the doctor. There is everybody is saying miscommunication was there. So doctors are saying no, we communicated properly, and there is so much emotional distress. The patients are attendants are doing the violence, and then they are saying we are emotionally disturbed seeing our relative in the bad shape. So what do you think about this? What is the main reason for this violence?
Honestly, Jyoti, it's very difficult to pinpoint a single reason, right? Violence stems from basic abusive behavior. And when there is no deterrence, it takes a life of its own, right? So let's start by looking at the various kinds of violence which can occur. There is, of course, physical violence where the body of the doctors. There is violence against infrastructure, where although people may not be harmed, the infrastructure is broken down. There is emotional violence. For example, a patient coming and telling you, "Doctor, आपको तो कुछ मालूम ही नहीं है, ये क्या कर रहे हो?" You see, there is, of course, the abusive violence where a patient may abuse you. And there is also the kind of, passive aggressive kind of violence where a patient says, "Doctor, I'm suffering so much and you're not doing anything." And I know that this talk is on violence against doctors, but there might be some patients also hearing this talk. And I just want to say this, that it is rather unfortunate that because of the misbehavior of a very, very small number of patients, there is a feeling of general mistrust or distrust. The fact of the matter is that most patients are wonderful people. I mean, even if the audience would just think back on your last, let's say, 100 patients, you'll find that most of your patients are wonderful, beautiful people who are ever so nice, ever so grateful. And even when things don't go according to plan, once they are explained, etc., they do accept it. But there is the small minority, and you know what they say about the vocal minority outshouting the silent majority. It is the bane of a doctor's life that you always remember the bad parts. you never remember the good parts. If you had done 100 surgeries and in one of them, if you had a problem, you'll probably remember that one surgery. You won't remember the 99 other surgeries. And similar to that, this issue. So let me sort of start from there to say that in most instances, patients are absolutely wonderful people. But then something like this happens and it completely spoils the equation. And it takes some time for a doctor to recover. I don't think it is appreciated of how much doctors feel for their patients. Imagine, for example, you have a patient who's got a hyperstimulation. Imagine you have a patient who had a arrest on the table and was revived. Imagine you have a patient with amniotic fluid embolism and is now on the ventilator. I can assure you that there will hardly be any doctor in situations like this who will not lose sleep at night. Yes. I think patients underestimate how much they affect us as human beings. Forget about practice, etc. So when the patient tells you something, you tend to ruminate over it, you tend to mull over it, you tend to sometimes question yourself. Could I have done something better? Could I have done something which might have resulted in something different, and so on and so forth? And this is the way medicine is. That's why, in a way, what we do is called practice. Yes. I remember someone saying that if you're practicing all the time, when will you become perfect? So it is the nature of medicine to be that way. So just to reiterate, the overwhelmingly large majority of patients are absolutely wonderful and beautiful people. And it's unfortunate that that small minority sort of ruins the whole equation. Having said that, Jyoti, I think you asked me the question. Yeah, you asked me the question about emotional violence, yes. Right?
Yes.
And I think that to a certain extent, it depends on the context, it depends on the setting, and it also depends on how you are criticized, with what tone, how many people, and so on and so forth. Emotions are different for different people, and what may be hurtful to one person may not be hurtful to another. But there is no denying that emotional violence exists, abusive behavior exists, and as they say, sticks and stones, kind of a situation. But over here, words are extraordinarily hurtful. Because as doctors, our practice of medicine is the core of what we are. And if someone insinuates that we are not fulfilling the core of our being, then obviously that doctor is bound to feel bad, is bound to ruminate over it, is bound to lose sleep over it. So I think both kinds of abuses are important, and there should really, and I'll reiterate this again and again, that there is simply no worldly reason why a doctor should be abused, one way or another. Now, when you say this, it is taken that doctors are not open to criticism, right? But that is far from the truth, right? You look at any society in the world where there are reviews. All right, patients are free to give reviews about their doctors, but are doctors allowed to give reviews for their patients?
No, sir. But right now you said no. We are
Absolutely
having
not.
99 patients are good. Many patients you have delivered, they have putting their baby's name Jaydeep. Many patients I have delivered, they put their girl daughter's name Jyoti. There are 99% of the people are like that. But the most of the time when we are seeing in the media, in the general public, when they gather, we see the news reports, news channels, and the number of the comments by readers saying that doctors have become lazy and they deserve to be beaten up or they deserve to be criticized. And this public sentiment actually against doctors is nowadays predominantly negative by media. So how can this media and public perception influence the things to be going? Miss, are you thinking this media and public perception is...
Yeah. I think it's crucial actually, but let me just complete what you had asked earlier in terms of gender, age, and resource settings.
Yes.
There is data to show, and I think this is a study done in 2016 by Kumar and Verma, which was reported in the Indian Journal of Clinical Diagnosis, which said that doctors who are younger and doctors who are women are more prone to have violence perpetrated against them.
Yes.
I think that data point is clear, and I think I can say that from whatever little personal experience I have of this, I would pretty much agree with that. There is also the fact that the reason for the violence or the reason given for the violence, I'm not saying it's a valid reason at all, as I already said, and I'll again reiterate, there is no earthly reason why there should be violence. But it seems that in low resource settings or in public health settings, the violence has more to do with the lack of infrastructure or the lack of human resource and less to do with the result or the outcome. In a high resource setting or in private or even tertiary care public hospitals, it seems that the violence has more to do with either human resource or the outcome, or sometimes even financial. So, the reason you need to think about this is that the intervention required to address the issue of violence in each of these settings theoretically needs to be different, right? Now, coming to the question that you asked just now,
Media
the
and
role of media.
because sir,
Okay,
few years ago we are seeing doctors as a god in even films, in the serials and everywhere. And nowadays there
yeah,
are so many films coming where they are just putting doctors' image like money-minded or lazy, or doctors not knowing nothing, or patient is died in the OT or whatever. So do you think that media, film, OTT platforms, this all influence on this particular subject?
yes. So I'm sure that it influences. I mean, I have absolutely no doubt that there is the influence. And I think what you have to look at is the end result of the influence. Because whenever in media or in popular culture, you show the doctor as a villain, the person perpetrating the violence is the victim. And then it is seen as a victory of the underdog, where the doctor is some kind of a superior kind of a being. And then the underdog comes in and then wins against the doctor. It's like in Chak De India, that hockey team, which was not very good and was the underdog, wins against a hockey team which was supposed to be the winner. So people always like underdog stories, right? If an underdog comes in and then wins, it's heartwarming, it's touching, it's emotional, and it's also in a way a situation where people feel the end justifies the means. And this, I think, is a basic narrative problem with the way violence against doctors is portrayed in the media. It's always shown as something which was justified. मेरी बहन मर गई, तुमने कुछ नहीं किया, ऑक्सीजन किधर है, ये किधर है, डॉक्टर क्या कर रहा है, and then there is violence. So there is always a reason that is given for the violence. In fact, there's a very interesting study, Jyoti, which I found. It's a study by Mayuri Samant and Sumit Kane. It's reported in a journal called Social Science and Medicine. So what they did was they looked at one Marathi publication called Sakad, and they looked at all the stories which had been printed in Sakad on violence against doctors for the last 5 years. They found that there were approximately 60 stories on this over the last 5 years. And they looked at these stories from two contexts. One, they looked at it from the context of narratology. Narratology is like, for example, it focuses on the narrative or the storytelling within a given text, and it emphasizes on meaning that may be produced by the structure and the choice of words. As I said, giving a reason for the violence. And then they took a second approach and they looked at the semiotics of the story. Semiotics is something like the interpretation of sign and sign systems and how readers might interpret or decode these signs, right? What they found was that the stories fell into four broad categories. There were pieces reporting agitations, pieces reporting specific views of the doctors, special articles written by civic society or lawyers around the issue, and then there were some news pieces about what initiatives doctors have taken. What they found was that in all this narrative, it seemed that victimization was the key around the narrative. Did the story say that the doctor was a victim, or did the story say that the patient was a victim and therefore justified in violence? So again, it comes to how you justify the incident. And again, I will say, there is no justification for violence. And
Very
that
well
is
said.
something that we need to tell all the media. It also seemed that sometimes in the articles which doctors themselves had written, doctors sometimes justified the violence, maybe indirectly, by saying that, there must have been poor communication. Or by saying that, oxygen to hona chahiye na, aise thodi chalta hai. Of course, oxygen hona chahiye, but is that a justification for violence? Whenever we have a problem, for example, somebody doesn't pay fees or something, we are told that you can't do anything, you have to discharge the patient. You can't do anything. You have appropriate legal recourse, you take that. Why can't we tell the patients that? They have appropriate legal recourse for anything that they would like to do. They can take it. Why are you perpetrating violence against the doctors? So definitely all this kind of narrative definitely makes a difference. I think it is high time. And I have participated in several media workshops on this issue independently outside of Foxy, where I've been invited by some news publications to speak to journalists about what narratives or what stories would people be interested in about doctors. And I must tell you that when I have done this, I have always found the journalists to be quite sympathetic towards doctors. It's not that they are not sympathetic, but sometimes they feel that the story becomes better by projecting the patients as victims.
Yes.
So ultimately, everybody is a slave of, clicks, likes, and so on and so forth. So just to make the story better, they will say कि हाँ ये नहीं था, तो वो emotionally upset हो गया, और वो emotionally upset हो गया इसलिए डॉक्टर को मार दिया. ऐसे थोड़ी चलता है.
The sympathization and actually
Yes.
negativity and everything, these are having the impact on the public mind.
Yes.
You are now, just a personal question. You are having two generation of the doctors and so many doctors in your own family. So at any time of your professional career, did you face any type of violence, be it emotional or physical or any verbal abuse, or even if your family members, anytime they suffered the late night calls, blackmailing calls, any type of such things?
I would have to say that honestly, we have been quite fortunate in this respect, touch wood. Otherwise, kal hi hoga. But yeah, we have been quite fortunate. So it's not that we've not had patients who have come and told us that maybe you did the wrong thing, or maybe they came and said, "Doctor, this charge is too much," or maybe they came and told us that things could have gone a little better, or maybe. So we used to run a nursing home, right? And running a nursing home is very different from going to a big hospital and practicing. So now we are, Parikshit and me are in transition and we are getting both the experiences.
Yes.
So in a nursing home, sometimes they don't so much come to you and tell you about the medical part, but they will tell you, like, for example, the mattress wasn't good. And what are you doing? You should take more care. Or maybe in the night, the staff did not respond to the bell properly. And then they get agitated with the staff. And then they come and they get agitated with you that my baby was crying and the staff did not come in the night. Of course, when you ask the staff will say, "No, doctor, we went immediately." So, you don't know at that point, what is true. So it would be unfair for me to say that we have never borne the brunt of a patient's anger, or we have never borne the brunt of a patient's emotional angst. But fortunately, touch wood, we have so far not experienced any kind of physical abuse or even damage to infrastructure or anything of that sort, which is not to say that we are not conscious of the fact that it could occur at any time, right? So we've been fortunate so far, but it is not to say that it can't occur. And I think it's this apprehension of what could occur, which is sometimes more troublesome than when it finally occurs.
Yes, but actually you are running your own nursing home, your own setup, then going to the corporate also, and you are fortunate enough. But there must be some reason, there must be some aggravating, some contributing factors for the rising of this violence against doctor. And there is some part deteriorating patient-doctor relationship. may it be the major cause for it? Because you also had a leadership of 46,000 gynecologists. They must have been called you so many times. So what do you think about this particular angle of the doctor-patient relationship for this violence against doctor?
Jyoti, I just want to say this, and again, I've said this like 4 times already, but I want to say this again. There
Yes,
is no reason there should be violence.
yes,
All right, there is no excuse, there is no reason for a relative to say कि मुझे अगर अच्छी तरह से समझाया होता तो मैं violence नहीं करता is complete bullshit. Okay, there is no reason for violence. All right, and I know that after the ICU and the casualty, obstetricians and gynecologists are those who are most subjected to violence.
yes.
Because we are dealing with a very emotive issue. We are dealing with childbirth, we are dealing with pregnancy, we are dealing with small children, and so on and so forth. If you ask me to point out one single reason why there seems to be an increased violence against doctors, I won't be able to give it. I think it's a societal change. I think it's a change which is driven by a different culture of the patient-doctor relationship. And again, I'm not saying that it's a bad thing to happen. All right, patients voicing their opinion, patients voicing their criticisms is welcome. That's the way we become better. But again, there is really no reason why there should be violence. To attribute the rising incidence of violence only to media, only to social media, only to a feeling of bravado, I think would be a bit of a mistake. It is also the other way around, no, Jyoti, that social media has really come into its own over the last 10 to 15 years. Before that, violence used to occur in some small place or a small village. There was no way for that news to reach us. Imagine we are 1.2, 1.3 billion people. Imagine the amount of healthcare facilities, the amount of healthcare interactions that are going on throughout the country. Right? There are probably millions of them happening. Right? It is not to say that violence against doctors never existed in the past. I, for one, I'm not a fan of this narrative of doctors being COVID warriors and all. I'll tell you why. Okay, I don't like the term COVID warrior because in a war, warriors are expendable. Doctors are not supposed to be expendable. Why are you calling us warriors? Okay, and you cannot say that since doctors are a noble profession, they should just lie down and take everything that is doled out by the patient. Absolutely not. So I think sometimes these words and language, that is also very important. So coming back, is it that we are now more aware of cases of violence which are occurring, which previously we were not aware of? Or is the violence really increasing? I don't think there's any systematic data anywhere to show. There is this famous survey done by the IMA, which very clearly shows that 70% of the doctors who were surveyed either had undergone some kind of abuse or violence, and 100% of the doctors apprehended violence.
Yes.
All right. But whether this is a new phenomenon or is this something which has come to light because we now have the means to access this information is something I believe which we need to reflect a little more.
Actually, there must be zero tolerance for violence, but still we can discuss about how does this healthcare system and workplace culture it contributes to prevent or to aggravate the violence against doctor. There must be something, sir. Many times we are always not in the form of doctor. Sometimes we are also patients attendants. So how would you define such things? There must be something about workplace culture, or there must be some loopholes in our healthcare system also, which may aggravate or which may prevent the violence.
Jyoti, it is my understanding that the strongest deterrence to violence is deterrence. And I think that we don't have deterrence. Okay, the impression is that I will do whatever I want and I will get away with it. I think this is the one strongest factor which leads to the multiplicity of issues of violence against doctors. There has to be a strong deterrent. And I think it's important that we talk about the legal deterrents and the deterrents which are specific to that healthcare facility. So if you look at the legal deterrence, I think for the longest time, all medical associations have been advocating that there should be a central law for the prevention of violence against doctors and for addressing the violence against doctors when it occurs. So what stops us from doing it? I believe that in a way there is an issue which is in the framework of how our country is made, because health is supposed to be a state subject. It doesn't stop the government from making national policies. So even if we don't have a law, at least let's have a kind of a policy which can then be adopted by the states. It's not good enough to say that health is a state subject, so let the states deal with it. I think the center definitely needs to do something about this. It either needs to promulgate a law, and then let's take, for example, the MTP law, right? If health was a state subject, MTP law is there, and then within the MTP law, the states have been given certain powers in the regulations. Why can't we adopt a structure like this? But even in the states where the law has been passed, for example, Maharashtra and Karnataka, the law is actually not implemented in the best way. From what I have read, I understand that the Kerala Healthcare Service Persons and Healthcare Service Institutions Amendment Act of 2023 is perhaps one of the strongest state laws in India for protecting health professionals. Maybe we can look to that and have more states adopting this and having deterrence. There is also facility level deterrence, where the presence of an adequate security system, the presence of courts, the presence of reacting when you think that things are going wrong can, in a way, preempt. Perhaps help to a certain extent, but will it address the core issue? I'm not so sure. I think your core issue will probably need to be addressed by behavioral change, by societal change, and a deeper analysis of what perpetrates violence in the first place.
Sir, just we are actually protesting and demanding the central law. There are so many laws since actually I just read in 1860 section 220, 320 they started, and then this Prevention of Violence Against Healthcare Professional and Clinical Establishment Bill in 2022. This is the latest one, but there are no stringent punishments. I have a
Exactly.
so what means what the government should do? Just we are making all the position statements we are having in the talk with the government officials most of the time, because I saw in the 2019, then 2020, and then 2022 the amendment and the proposed bill was there, but there is no actually strict action taken against the this attendants who are doing this violence. So what is your take
So,
actually?
Jyoti, I mean, it would be easy to say that if the problem is of not enough punishment, just punish them more. But the issue here is really that we have a judicial process, and when you are on the other side of the judicial process, sometimes the process itself is the punishment, right? So, what do we want to achieve by this adequate punishment? One is that the justice should be speedy. Okay, there is no point in a trial coming up. So suppose I have an incidence of violence and the complaint is filed against a patient. I am already I'm not old by any means, but I am already quite senior. Now, if the case is going to come after 20 years, I'm not sure that I'll be interested in pursuing that case for 20 years.
Actually,
There
it
is
itself
also
is a
the fact.
violence. It
Exactly.
itself is a violence for doctor.
Exactly. So, I mean, yeah, in your extreme ideology, you could say that it's judicial violence against doctors. But I mean, let's not sort of get into that conversation. But I think that there has to be some kind of a way where there is an immediate consequence, right, for violence against doctors. Now,
Yes,
what that
this is
immediate consequence should be is extremely debatable, and it's ethically very fraught. Because at what point will you say that this is so severe that you can withhold healthcare? You can never withhold healthcare, particularly in an emergency, right? I know that we go on strikes for. Let me just give you the example of people going on strike. So there is data to show that the incidence of strikes, okay, after violence against doctors, all right, fluctuates from year to year. There was a given year where there were 17 strikes. And the last data I have is from 2019, where there were 12 strikes. All right. Now, strikes are a great form of protest. But are strikes the right instrument to achieve change? I'm not sure. We need to approach strikes in a different way. I remember I was part of a discussion in one sort of a forum where we were talking about a strike. And I said, see, strikes in the private sector are not sustainable. How many days can I not go to the clinic and not see patients? Right? Therefore, we need to approach strike in a different way. And perhaps, in your next podcast, I know you're not allowed to repeat any people,
We
but
are allowed,
perhaps
sir.
you could perhaps discuss how do you make medical protest more effective?
Yes.
Right? I think that's a very, very big and long discussion that we need to have. Because just holding black flags, protesting, of course, it's a great way to raise awareness, and we have to make our voice heard. I have nothing against what we are doing, but I think that if we keep on doing the same thing and expecting different results, we may perhaps not land up where we want to be. We have to find better and more innovative ways to make our voice heard.
Yes, there should be a fast trial court also, because it is again and again the punishment for the doctors actually skipping the OPDs and OTs and going to the court. So actually the
Absolutely.
attendants are actually they are going court, but the doctor who is not the victim, he is also going to the court and actually missing everything. So the actually need of the fast trial court is also actually it should be in the India.
Yeah.
And do you think there should be some trainings for doctor, like de-escalation or some awareness training or some, many a times I am actually seeing the memes, doctor is actually having with gun or the boxing gloves. So, or some mental awareness or meditation classes, because they are getting so much of the stress. And most of the
Yeah.
time, the doctors are doing training for the other doctor, the meditation training, the awareness training, the mental trauma, how to get rid of this mental trauma. So, do you think there are some this role of some trainings like this?
See, I think, of course, training is required. For example, there is something known as a stamp approach. Okay, this has been published way back in 2007 in one of the journals. So the stamp approach says that when the patient, okay, has changes in behavior, which are exemplified by the acronym STAMP, which is staring, tone, anxiety, mumbling, and pacing. All right, you are supposed to then become alert that this patient may resort to some kind of a violent behavior or abusive behavior. So you need to be proactive at that point. And one of the things that I've learned over a period of time is to never talk to patients in the corridor of the hospital, particularly when there's a large crowd. Okay, I always tell them, come into my cabin, right? I sit down, I make all of them sit down. Even if there are 10 people, I get stools from the patient rooms and make sure all of them are sitting down so that all of us are at one level. Okay, and then I talk to them. Typically, what you will find in this kind of a situation, and this is just some practical experience I'm sharing, is that there will be one or two very vocal people in that whole crowd. Okay. But in addressing, the mistake we make is that in addressing those one or two vocal people, we should not ignore the rest of the crowd. Otherwise, some other people will also become vocal. All right. And I normally, when I have a situation like this, fortunately quite rare, but when I have a situation, as I said, I never make this discussion in the patient's room or in the corridor. I always call them to my office. I always try and make sure that all of them are seated. Okay, I offer them water first, and first I sympathize with them. I never say sorry. You should not say sorry. All right, but you should sympathize with them because something has gone wrong and you should sympathize with them. Once you sympathize with them, you should hear them out. Even if they are, sometimes, they scream, they shout and all that, but you should have the patience to hear them. Okay, and after you hear them out, you present your point of view. And then at the end of that, you ask them, is there anything else you want to ask me? All right. And then after they say yes or they no, after I answer this, I said, see, now this has happened and this is now what we can expect. And after this discussion is over, to end the discussion, I never tell them, now you go, the discussion is over. I always tell them, now please let me go and see the patient. All right. It conveys a sense of caring. All right. And it sort of allows me to tell them to leave the office.
Yes.
All right. So then I always go, and in the patient where something has not gone according to plan, the human tendency is to avoid seeing that patient or trying to see that patient as little as possible or sending the juniors. This is the patient where the exact reverse should be done. All right. If a patient has had an IUFT, if she's had a stillbirth, if there's been an asphyxia, or if she's had a bad PPH or she's had a bad perineal, this is a patient you should go and see 3-4 times a day. Okay, and patients really appreciate this. Some of the patients who have been with me, I've been in practice now since 98. Some of the patients who have been with me the longest are the patients who initially had the poorest outcomes. Okay, so again, I'm not saying this is a panacea. Okay, and I'm not trying to make an excuse for violence, mind you. I'm just trying to pass on some practical tips of what I have found to be useful when things have not gone, according to plan. So from, like if you take a little practical approach, spend time, usually things don't escalate to that point, but again, there is no excuse. I think that needs to be said again and again.
Actually, you gave all the practical tips. Actually, as a colleague, as a senior, we always give practical tips to our juniors or our the house doctors, everyone, what you should do. Like, means we are preaching to our doctors. But as you are the pioneer in building bridges between the government, private sector, and between the doctor body, our organization, and government sector. So, asking you this question, that what can the general public do to support the violence against healthcare worker, or to reducing the violence and improving safety? What doctor has to do, he or she will do. We will actually improve our quality care in the hospital setup, everything, whatever. If you say, Jyoti, in your hospital, this is, I am seeing this is not up to the mark, I will do that. But what general public should do, because the audience, we are putting this podcast in the YouTube, so this series, it will be having the viewership of the non-medical audience also. So it is very important what general public is doing for the doctors, what general public is doing to reduce the violence against healthcare worker. What you suggest, sir?
I think it's, Jyoti, to actually proactively do something to reduce violence against doctors. But certainly it is not too much of an ask to tell civic society in general to become more accepting of medical outcomes and temper their expectations. Okay, just to give you an example, and you know that I have told this story so many times, when I have given my talk on cesarean, you have, for example, a patient whom you're seeing since, the time that she's pregnant. And then, if something does not go according to plan or something goes wrong, the first thing the patient will tell you, but doctor, till now you are saying everything is normal. Then what happened? So this little tempering of expectations, this little communication and understanding from the patient's side, that medicine is not a exact art. Okay, it is an art. I think we are sort of in all this thing about evidence based and all, we are losing this sense or nuance of the fact that at the cutting edge, of when things go wrong or something, medicine is still an art. Okay, like for example, it is now after so many years, hopefully, experienced obstetrician puts the hand on the woman's abdomen and feels, no, there seems to be less the growth doesn't seem to be that good. The seriousness with which you take the complaint of reduced fetal movement and so on and so forth. So I think there needs to be an understanding from the community. okay, that medicine is not an exact science and an art, and there is no way that anybody in the world can tell you about everything that can possibly go wrong. Okay, because if we start doing that, our patients will live permanently in fear. Okay, right from the time they are 6 weeks pregnant to the time they give birth, their whole pregnancy, instead of being an experience of joy, will be an experience of fear and apprehension of what will happen to me at the time of labor and delivery, because that is when most problems occur. So I think this little understanding from the community could really go a long way in changing expectations and tempering hope.
Sir, at the time when you gave me the task of making this statement for the
Yes.
violence against doctors, you briefed me many things. And that time I studied a lot and I came across one word, improving health literacy. Uh, Actually, it should be part of our everyone's education from the actually primary school or middle school. Do you want to say something about this, the health literacy?
Health literacy exists already.
Yes.
The problem is, so again, let me give you an example from a lecture which I give. If somebody would open their browser and do a simple Google search for childbirth, it would throw up millions and millions of hits. All right. The problem is not that patients don't want to be literate. I think it is very, very condescending to say that patients don't want to be informed. Patients just want to rely on your word. No, patients want to be informed. Patient wants to know what is wrong with her. The patient wants to have agency of what is having with what's happening with her own body and what are you going to do with her body. The problem is that there are not enough authentic, affordable, and available solutions for healthcare information. And I think this is one of the things which is great about this podcast, because if it's going to be open to the public and publicized in the community, hopefully the community will become that much more aware of where to find good sources of information from.
Actually, whenever we are seeing in the middle school or in the high school, or even if we are breaking some rules, the traffic signals, if we are actually starting sending the kids to the ICU, means the care for the patient to the ICU for 2 days, they should know what sort of things going on in the ICU or with the patient care or with the doctor. Actually, the improving health literacy means to just educate the children since the childhood, because all of sudden as a being a adult and they are seeing their parents ailing parents in the ICU and going in the bedside, they are not coping up. Actually they are not knowing anything about the what is going on in the hospital. I think there should be some community classes for 15 days or 20 days in the 12th 11th standard to go in the school to see school means to go to the hospital to see what sort of sacrifices doctors are doing, what sort of things are going on in the hospital. Sir, last
Sure.
one question. I just want just a very difficult one, as you said you never actually encounter such things. But being a female gynecologist, being a female as a gynecologist, we have to actually talk to the so much of the attendants, in-laws, parents, brother-in-law, sister-in-law. Means there are so many people. With one patient, there are actually 10, 15 attendants.
Yeah.
So many times we are feeling their verbal abuse in the form of soft abuse, you can say.
Yeah.
So what effect does it have on patient care and overall healthcare environment? If the doctor is feeling means the doctor is feeling something abusive is going on, or once in a lifetime something beating, or the means sometime of your setup is broken down, everything. So this is a bad impact. What do you think about this particular situation? The effect is the actually life lasting. If some colleague is having some problem with some patient attendant, she stops doing the night calls. We are seeing, my own daughter is doing internship. She stopped doing for the night duties for the 7 days when some bad thing happens in the country. They read, they stop going in the night duties. What do you think about this?
It would be really, foolish to say that these kind of things don't affect doctors. But I think we are one of those really rare professionals who rise above this. Okay, we can of course justifiably take some time off, but I believe that we come back stronger It's not to say that abuse us so that we come back stronger. I hope no one misconstrues it. But at the same time, I believe we are one of those very resilient professionals. We are very, very strong mentally. And I think that, when we come back, we put it behind us and we come back and we try and deliver the best possible service that we can to our patients.
Yeah.
I think it's important to take some time off when something like this happens. It's important to take time off and then really be ready to come back before you decide to go back to work. If you had some abusive experience, it should not happen that you have it in the morning and in the evening you go to the OPD. You can always have someone to look after your practice for a couple of days. Just recover, give yourself that mental space to reflect upon it, to recover, and then go back to work. And I can tell you from the fact that I have spoken to so many people who had this bad experience, that when they've gone back with a renewed sense of purpose. They've gone back stronger than before, and they have actually delivered wonderful care irrespective of what has happened to them. And I think this is something which is so laudable about medicine and doctors as a profession.
Thank you, sir. Actually, sometimes when the violence happens in morning and in evening, the particular doctor is having actually negative impact, and the decision-making capacity of that doctor at that particular time actually this reduced. Because at particular, that's, as you said, take rest for 1 day if something happens, or when you feel good, then only go to the work. As you say, final
It's like,
word.
if you have a car accident,
Huh.
you don't just continue driving, no?
For 2 days.
You stand on the side of the road for like 5-10 minutes before you continue driving.
Yes.
So, I mean, you can't really compare. It's a false equivalence, but it's something like that. Take a pause,
Yes.
okay, and then go back stronger then.
Some take-home messages for our viewers, sir, for this particular issue.
No, I think there will probably come a time when, hopefully this will never occur. But till that time, we really have to consider it as a serious problem. We don't have to say that अरे मुझे तो नहीं हुआ है तो मुझे तो नहीं होगा, वो दूसरे लोगों ने कुछ गलत किया होगा इसकी वजह से हुआ. Okay, I think this is completely wrong. Everyone is equally vulnerable. Doctors, nurses, all healthcare professionals, everyone is equally vulnerable. You cannot be complacent and say that because it's not happened to me so far, it's never going to happen to me. You have to be sympathetic and empathetic and always willing to help your colleagues who have undergone this problem. And also remember that abuse is not limited to doctors alone. We say violence against doctors, but there's an entire healthcare ecosystem. So if sometimes if something happens to the doctor, something equally bad has happened to the other people in that healthcare ecosystem. What about the nurses? What about the ward boys? What about the attendants? You have to care about everybody in the healthcare ecosystem and make sure that everybody is in a good mental space, to provide healthcare. And I think lastly, this is something that we had toyed with, and now I think Parikshit and we will probably implement it. There was something known as a patient activation measure. I don't know how many people have heard of it. And it sort of tracked how well patients comply with directions. And the reimbursement of their insurance was linked to their patient activation measure score. I think there will come a time when something like this will come to our country also, and there will be some way of reporting abusive behavior. We are in the process of coming out with a website which, without revealing any confidential information about the patient, will still have the ability to create a peer-to-peer social network within the physicians to make them aware of which patients indulge in abusive behavior. It is certainly not meant to deprive anyone of healthcare. It is just meant to make sure that physicians are aware if someone within that area comes in and this thing. I would love to talk about it, but I think Jyoti, our time is up.
No, actually, I am also want to say this. There is So many regulatory authorities are there. Patient can launch a complaint there, and the violence is surely not the way. This just That's why I'm asking you this particular topic, sir. This can go for 30 days podcast series with so many questions. I just wanted to ask the take-home message. You just told it. There must be zero tolerance for violence. Any healthcare worker. Thank you very much, sir, for this very interactive session. And what sort of work you have done for all the doctors and this violence against doctor position statement. I thought you are the best person to talk about this subject, and actually, I think our viewers will be so happy to listen to all our your views. Thank you very much.
Thank you, Jyoti, and thank you, Sunita, and the entire Foxy leadership for
Yes,
putting
thank
this.
you, sir, Sunita
Thank-
madam, for this giving this wonderful platform to interact. This is very offbeat type of topics we are taking for patients and for viewers, for audience, medical, non-medical. So thank you, President Foxy Sunita madam, and thank you, Jaideep sir. Thank you very much.
Thank you. Bye. Bye.
Good night, sir.
Good night.